And set some things up here. Okay, there we go.
Uh,
How's everything going over
okay.
there? What country are you from?
I am Tosi Jones from Cameroon.
Oh, okay, that's an African country. Am I correct on that?
Yes, yes.
Oh,
It's
cool.
an African
Nice.
country.
Very, very nice to meet you. And what is your field of interest?
Sorry, I didn't get you.
What is your field of interest? Like, what do you
Okay,
study?
yes, I'm a nurse midwife.
Oh, okay.
I did
And
my
what, yeah, what's that consist of?
I did my bachelor's degree in nursing and midwifery, and my master's in midwifery, and I'm currently a PhD fellow in public health policy and administration.
Oh, wow. Okay, I'm a DBA student. I'm a doctor of business administration student. 5 courses to go. I know the feeling. PhDs are tough to go by these days. I hope the best of luck with you to get that done.
Yeah, that's right.
How far are you into that program?
Okay, I just deposited my work for defense, so I'm
Uh,
waiting for feedback from external reviewers.
oh, that's the
And
final
once
course.
the
That's the final course, isn't it?
yes, yeah,
Wow.
yeah.
Good luck. Good luck. Good luck. All right.
Thank you
So,
so much.
question one is, Tosi, you're a midwife who has spent years bringing babies safely into the world, and you're a man in field people, what is it, doesn't always expect. Tell us who you are and how you came to care so deeply about what happens to a mother's mind and not just her body.
Okay, thank you so much. Like I said, I'm Tosi Jones, and I've been working for the past 7 years in Cameroon, and precisely in the northwest region of Cameroon that has been hit by the crisis commonly known as the Anglophone crisis. And with this crisis, it has affected a lot of persons. So many thousands of persons have been displaced. So many have lost their jobs, their homes have been burned down. Even health facilities they have shut down. We have a lot of sexual assault. We have a lot of rape cases, and because of this, so many women they get through a lot of trauma. They get to be traumatized because of these experiences. We also find that there are a lot of women who have had a lot of unintended pregnancies. And even through my studies as a midwife, we realized that the curriculum, most of it was focused about caring for women in a normal situation, women who are healthy, women with who are not in the crisis affected zone. So because of this, we realized that a lot of women they go through pregnancy being traumatized, and that is why we've been working on what we call the perinatal mental health, where we assess these women from the time they get pregnant throughout their pregnancies. So we realize that some of them they end up being depressed because maybe the person responsible for the pregnancy they abandon them. They don't have money to pay for their bills because in our setting we have more of out of pocket payment, and that's why caused me to be interested in this maternal mental health and to work
So
more on it.
I just have a curious question here. Does your country have what's called welfare or food stamps or EBT cards or anything like that? Like we have in the United States, nothing like that?
No, it's not very effective. For example, we have what they call the universal health coverage that has they have tried to implement, but it's not really effective because it is expected that each woman that is pregnant, once you get to the facility, you are supposed to pay just a certain amount, but the most facilities they still have to pay all those bills. So we don't really. There's more of out of pocket payment.
Oh, wow. Okay, yeah. It's poor enough as it is there, right? And then they have to fork out more money that they really can't afford. Am I getting that correct?
Sorry, I didn't get you.
So they are cheap. It's hard to live there, right? So it's like a low income housing or low income elaborated jobs, right? So they have to pay out of their remaining salaries what it is, right?
Yeah, most of these women, especially in our context, they are not even working class women. Most of them they depend on the peasant farming. They are farmers mostly in those hard to reach areas because these are places where I've also worked now trying to see how we can empower them economically. Sometimes we train them on basic gardening, they can generate income and not depend only on the partner or family for decision making. Yeah, they are not persons that are in a working class to say that they expect maybe a salary at the end of the month. No, majority of these persons they don't even have something they rely on for
Wow.
financial
Okay.
support.
I get it. I get it. Okay. Question number two. Let's start simply because a lot of people misunderstood this. When we say a new mother is struggling after birth, what does it actually look like? Because I don't think it always is the crying we picture it is.
Okay, thank you for that. We have to understand that um, when it comes to mental health, it is not, especially depression after delivery, it is not caused by one factor. In fact, women actually experience a lot of challenges after delivery. For example, sometimes they have sleep deprivation because they have to spend time breastfeeding the baby. They are physically exhausted. They have experienced a lot of pain, and some are anxious. Maybe a mother who has delivered, she's still a first time mother, she's still trying to adapt with breastfeeding, they're anxious. And then maybe women too, like I was giving examples. If it is a woman who was raped or she's always physically assaulted by the partner, she's bound to get into some of these challenges. And then there are others too with low self-esteem. So because of these different factors, women might end up now being depressed. And it is something that the society needs to know. We need to understand that it is normal. And other factors, maybe the financial stress, you are pregnant or you've delivered, you are in the hospital, like a case that we had in the hospital. This woman was pregnant, the husband abandoned her. She delivered twins, and it was through a cesarean section. She had no one to pay her bills, and she was really broken because of this. And now there are pregnancies that are not also planned, and because of that these women they tend to get into depression. So the society, we need to understand that it is the contributing factors, they are multifaceted, and the earlier we identify some of these challenges and address, the better. I don't know if this helps with the question.
Well, yeah, absolutely. Do the best you can. I mean, not everything's all direct. Sometimes I'll come up with my own questions, but then Teddy will have like five questions for each and every show. So let's try number three. Here's what breaks my heart. So many women feel this and say nothing. They feel like admitting it makes them a bad mother. Why is there so much silence and shame around this? And is there even worse in the communities you work in?
Okay, thank you for that. The first thing is that many people tend to normalize the feeling. They feel that it is normal. They have not yet identified it as a problem. For example, when we start looking at depression, we talk about the mood swings, we talk about maybe crying. Some people easily they cry, some people they isolate themselves. But for if you are in a community where they even the family members or friends, people that they don't know about this, they identify those things and they will do nothing about it because they don't understand. So what I think and what we've done so far is that we try to create a lot of awareness. When these women come for their antenatal care, most of them they don't even come. We leave, we go to the community. We used to do what, because I work with the International Medical Corps for some time, we do mobile clinics where we live and we go to these women in very hard to reach areas. We sensitize them, we tell them, encourage them to come to the facility. When they come to the facility now, we begin to assess. And through the trainings that we have also had on mental health, we try to see how we can integrate mental health assessment into routine care. Like asking the women, how is the family, how is everything, how is their social life? We try to do some of these findings to know how their relationships or their experiences back at home, such that we can be able to guide them and help them diagnose some of these. So most of them they go through without actually discovering that it is a problem. And sometimes the health workers, so since many have not been trained to identify some of these cases, they go unnoticed, and maybe you just end up seeing a woman, in a bad situation. So that is it.
all explained. And you're actually one of the first people I've actually interviewed in this type of field, which is really, really cool. And I'm glad she picked this because it's like a very unique, unusual type of position that I don't usually get guests like this on the show, which is pretty cool.
Please, can you come again?
I said your subject is very interesting, and you're the first one I've interviewed with this type of subject, like people handling pregnancies, babies, women, and all that stuff, handling that as a different, unique topic.
Okay.
Yep, very, 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 very different, but very interesting in the same whole of what we can see what goes on with your countries and the struggles, people bringing people in the new world and stuff like kids and stuff like that. It's very, very difficult for sure.
Yeah,
Number
that's
four,
right.
for a tired new parent watching this, now, how do they tell the difference between the normal exhaustion of a newborn and something more serious they shouldn't have ignored? And what happens when it does get ignored?
Okay, okay. It's normal for a woman after delivery to maybe feel exhausted. Sometimes she feels that she's tired and so on. But now, when you start seeing that for a woman who has delivered, she begins to lose appetite, she's refusing to eat. Now she's having that feeling of hopelessness. You see maybe a woman is even expected to cry. Some may cry after delivery, after putting to birth. You might expect some to cry, but when the crying becomes persistent, if she keeps crying, that's something to look after. And maybe in some cases, if you start feeling like you need to harm yourself, you don't feel like the life is worth living again, or harming the baby, those are already signs that that woman is getting into maybe depression or mental health illnesses. So they need to look forward. If a woman starts feeling hopeless, she start having maybe severe headaches for no just cause, and maybe they do an assessment in the hospital, they see that there is nothing wrong. Those are some of the signs that we we have to watch out for. And we should know that, especially in crisis affected communities like this, so many women go through this, and we encourage even humanitarian workers, those in the community, to integrate this mental health psychosocial support to these women, to be able to access them, give them support in times of need.
Okay, final question, five. So let's talk hope. For the mother going through this right now and for the partner or family watching her go through it, what actually helps? What can the people around her do?
Okay. Uh, One thing we do is that we encourage male partner involvement, because we live in a society where we have patriarchal norms. Decisions are mostly made by the husbands or the male partners or other family members. So we encourage the partners to be involved. Once they come for antenatal or prenatal consultations, we take time to sensitize them and even how to prepare for delivery. For example, if you're a woman, you know that you are pregnant, who is going to take you to the hospital? Where are you going to deliver? If it happens that you'll be a cesarean section, are you saving some basic amounts that can help you to be able to pay your bills? So we prepare them psychologically and so on. And then now there is another strategy where we are using, where we try to empower these women. I'm sure I initially stated this, for women to be financially independent, on financial literacy. If they have maybe basic income, they need to save in preparation, so that if they are disappointed maybe by the person responsible for the pregnancy, they will be able to help themselves. And we also encourage them to identify who can be with them. When you look at the delivery plan, who will be with them in time of delivery, so that person that can give them that moral support. Because we realize that there are some of the women who are pregnant, they come during labor and they are crying. Some start crying, not even because of the labor pains, but because of the treatment they are receiving back at home. So we encourage them to identify someone that could be with them, that can be with them, and we also encourage them in this moment. So this is a strategy that we are actually using in the community. We go to the communities now, we sensitize these women about these strategies that will help them, and then to also identify maybe things that they can do that will make them happy and so on. And we encourage them to come for their ANC prenatal consultations. Thank you.
Yeah, very well presented here in this other episode of how people go through the struggles with pregnancies, women, and all that stuff, families, husbands, wives, the struggle, financial regards, and stuff like that, and how they get help. Um, Here in the United States, it's just totally different. Like families get food stamps, they get an EBT card. However, we've been cut back. We've been cut back big time when people need that money. And I'm just saying right now, whatever you guys are going through, we pray for you out there and hope it gets better before it gets worse. Because everybody needs that little like, jump of encouragement, motivation. I mean, I'm sure there's days you feel like, why am I still in this field? Because you want to help people.
Yeah,
That's why.
yeah,
You know what I mean? It gets a
yes,
little bit emotional when some people go through stuff like that and they need help and people always asking for donations and stuff like that. We're not there. As Americans, we're not there. You're there. You experience, you witness it. So this is definitely I want to see more interviews like this brought up so people see it from the U.S. standpoint of what Cameron people and African people actually do go through with struggles like that. Because it, people say they're struggling here, but guess what? They're struggling even in the different African countries, Ethiopia, Somalia, all the children not like not getting food, hunger, dying of hunger and stuff like that. So you know what I mean? It's happening.
yeah,
Sure.
that's right.
Well, I appreciate your time. And one other thing I'd like to say is I want you to accept my LinkedIn invite so I can recommend your work and you can recommend my show to your friends, and then we just do the trade on that. I already I believe I looked up the right profile. I'm pretty sure on this because there's not too many people that name it Tosi Jones or anything like that. So I looked it up there and it came under that name. So my name will be Thomas Kilbasinski and it'll be under that LinkedIn post. But again, thank you so much for taking your time out today on your busy schedule and good luck and keep on doing good for your community.
Thank you so much, sir. Just to say that, let me just share the experience and what we've been doing so far because I founded a foundation, an organization which is known as Tosi's Mother and Child Health Foundation. And
Wow.
the problem we are trying to solve is the problem of the delays because we realize that most of even this when it comes to mental health challenges, we have delay in seeking care, delay in reaching care, and delay in receiving care, especially in the crisis context. So the strategies we are using, we are doing facility based capacity building for workers, for nurses and midwives, for them to be able to handle these obstetric emergencies. There are some women that they don't only face challenges. Cameroon is one of the countries with the highest burden of maternal mortality, where you see women continue to die from preventable causes. So we live now, we go to these communities, we train the health workers on emergency obstetric care. We train community workers on danger signs in pregnancy for the women to recognize. We train them on these delays, and then now we also uh, give them the referral links for them to be able to refer these women to the hospital. And before the community aspect, where we carry out sensitization in the community, and we have economic empowerment workshops for women where we train them on gardening and then financial literacy for them to be able to save. Those are the strategies that we are using to solve this problem, and that is what my thesis they're all about. It's all about the three delay model. That's delay in deciding to seek care, delay and things that may contribute to delay in deciding to seek care. You have lack of knowledge, maybe of these danger signs. Maybe a woman is persistently feeling sad. No family member can identify. She's pregnant, she is bleeding, but she feels that it is normal. She's having severe headache, but she does not understand that there's an underlying cause. So now the second delay now is distance. She has made a decision. Now there are gunshots, the roads are bad. She definitely reaches the hospital late, and when she reached the hospital with that poor condition, their health workers facilities have shut down. Those that are there, they are not really skilled in emergency obstetric care. So we are tackling all these three delays, and we are also integrating technology. Like now, we've developed a mobile app that we want to see how it can link up health facilities, so that such that before a woman is referred from the primary healthcare facility, the next level is contacted. Community workers are linked. The women can receive SMS notifications about the appointments. We can call and remind them for them to know about their rendezvous. and so on and so forth. So those are some of the strategies that we are putting in place to solve this problem.
Wow. Okay. So you're the first guest to speak right after I was about ready to end the show to give all that valuable information. Good. Good. Very good. That's very helpful information. It makes us well aware of what is going on over there. And I appreciate that so much. And we'll make sure we're all aware of it. We'll be putting this out on Twitter, LinkedIn, all the other social media platforms so people can see it.
Okay, so thank you so much.
Yep. And I thank you, and you have a magnificent day. And let's connect on LinkedIn and recommend each other's work. Check for the after this, check for the invite on LinkedIn. Okay, so we can connect on there. All right. I appreciate your
Okay,
time.
so thank you very much.
Have a nice day.
Thank
Thank
you.